challenging, and I know this video has been a long time coming. I'm sorry. So I heard about Mo from a friend, Marvelous Mo. I looked him up on Facebook. I contacted him and he contacted me back. I told him I was ready to do the program. It was for 4 weeks, but I did mine for 12 weeks because I knew I needed to know my content and know how to answer questions. So now, if you're out there and you want to study, you need something to prep you for the NCLEX, look no more. Look no more. Go for Arena for Slides because that's the deal. It's the real deal. You know, at some point, Mo kept on talking about traditional learning. I think that is key. Having to read a tons of textbooks and notes is not going to help you prep for the NCLEX. But the method Mo uses in teaching for NCLEX RN or NCLEX PN or whatever NCLEX you're taking is like the key. You answer questions, you go through, you answer questions, and then when you get to the content part of the question, it teaches you content. And then at the end of the week, you have to do questions, and I know it's quite challenging and demanding, but I mean, if you want your license, you have to sacrifice a whole lot. The program is quite expensive, I know, but I mean, it's still like a sacrifice. It's like an investment. You know, you invest and then you get something back. See, I'm an RN. So if I can do this, you can do it. Go be an Alpha Slice. Get off the fence. Go get your license.
Hello, hello, hello. How you doing? Oh my God, finally the moment is here and we're gonna kick this training off. Listen, we got all the mindset videos out of the way and now we're gonna start training. So I want your 100% attention and dedication, all right? So listen, I would like to welcome you to the self-paced virtual trainer. Listen, the next time you're gonna sit for your NCLEX, you're gonna be on the wall of testimonials amongst thousands of nurses who took this crash course and passed on their very next attempt, and you are no different. Listen, the road to become an Alpha Slice is not easy. And I would like to officially welcome you to the Alpha Slice family because now we are family and we care about each other. So now you have an idea of how this course works. So I'm gonna kick it off with the first question. You're gonna see the question, we're gonna discuss it, and then I'm gonna move to the content, which is the nursing content that you are going to love. Make sure if you wanna write down your notes, either write them down on a notebook, piece of paper, keep them in one place, or you can write them right there. Just click on My Notes and type in all the note taking that you wanna take, all right? Listen, the first question is, the nurse is providing care for several patients that arrive to the convenient care at the same time. Which patient will the nurse assess first? Listen, I would like to stop here real quick and talk about something very, very important. Anytime you read a question, the subject of the question, we're gonna read it 3 times. So the first time is gonna be general reading, just like we did. The second time, we're gonna highlight keywords. So when I read it the second time, the first thing I want you to think about is keywords. So what are the keywords that you are going to highlight? And we're gonna highlight them together. And then the third time, you and me will look each other in the eye and we're gonna rephrase the question in our own words, okay? So I'm gonna read it the second time, and now we are looking for keywords, okay? So the nurse is providing care for several patients that arrived at the convenient care at the same time. Which patient will the nurse assess first? Listen, to me, convenient care is one of the keywords. Whenever I read an NCLEX question, I want to picture myself in that environment. Because when you picture yourself, like you literally close your eyes, you picture yourself where you are. Let's say you are in the ER. Let's say you are in convenient care, home care, at the patient's own house. If you just picture that, you can make a conscious decision of what is your next step, and you will be able to pick up the right answer. So I always choose the environment as a keyword. It's not the most important keyword, but I just keep it in mind, okay? So convenient care is one of the keywords. The second keyword that I would choose is first. That tells me that this is a priority question. So I'm looking for the first thing that I'm gonna do when I see those patients, all right? So now that I've highlighted the keywords, listen, you and me are going to rephrase the question in our own words, okay? So this is what I'm picturing. I'm picturing that I've got 4 patients, came to convenient care, and I'm right there, and I want to see who is the patient that I'm going to assess first. That's it. Now, when I look at the option, keep in mind, here we're going to use the prioritization strategy. And after this question, I'm going to show you the algorithm for prioritization strategy that you will love it and you will use it with every single prioritization question out there. You're going to love those questions. Listen, questions like prioritization, SATA questions, delegations, I'm going to teach you techniques that are going to blow your mind away. Every time you use that technique, it's going to work. Okay? So listen, I'm going to read the options, you and me. The first option is 15-year-old with severe headache, stiff neck, and high temperature. Number 2, 27, and listen, when I read the option, I want to picture like what's going on with that patient. In this case, those are signs and symptoms for what exactly? Okay, signs and symptoms for what exactly? I mean, whenever you see stiff neck, that's a hallmark for meningitis. Later on, we're going to discuss meningitis. In this question, we're going to focus on prioritization, okay? So number 1, 15-year-old with severe headache, stiff neck, and high temp. The first thing that comes into my mind is a meningitis patient. Patient number 2 is a 27-year-old patient with a fever, vomiting, abdominal cramping, and diarrhea. So in this question, those are signs and symptoms for what exactly, right? If you just isolate this option and think about this patient in particular, I would say dehydration, okay? So I'm gonna move on. Patient number 3 is a 60-year-old with arthritis and having severe pain. So this patient has arthritis and he's having pain. It could be pain in the fingers, elbows, knees, whatever the case might be. Okay, so it's arthritis, it's pain. How serious is that? For me, it's not that serious, so I would not prioritize this option over, for example, a dehydration patient or a meningitis patient. So option number 3, a 43-year-old with dysuria, severe burning with urinating, and fever. Number 4, the first thing I'm gonna think about is UTI, all right? So this is a UTI patient, he has some sort of infection. So how am I going to deal with prioritization question? To me, in this question, the most important patient that I'm gonna look at first is a meningitis patient, okay? What I'm thinking about is this patient is life-threatening, I need to put him on isolation, all this kind of stuff. So definitely, number 1 is the right answer. Let's read the rationale together. The patient's symptoms indicate meningitis and should be assessed first. Listen, option number 2, this patient will be the second for me to look at. The third patient I would look at is patient number 4. The patient who is experiencing infection, most probably urinary tract infection. And the last patient I'm gonna look at is a patient with arthritis experiencing pain. Right, so now let's look at the prioritization strategy, which is gonna blow your mind away. So prioritization. Listen, first off, I want you to keep in mind, ABC's beep. This is the algorithm. ABC, and then a little s, which is safety. I'm gonna tell you what ABCs are, and then beep, okay? So you start off with A, which is airway, and then B is breathing, C, circulation, S, safety. The first P is pain, E is education, the second E is emotions, and the last P is psychotic patients, excluding those who are having suicidal thoughts, okay? So we're gonna start with airway. So when you look at the patients and the options, anytime there's a patient who is experiencing airway problems, you gotta give attention to that patient first, okay? Next is breathing problems. Then you are going to look at patients who are experiencing circulation problems. So you're gonna look at patients who are having hypertension, maybe tachycardia, maybe hypertension, some kind of MI, maybe shock, signs of dehydration, and so on and so forth. Okay, so circulation is number 3. Number 4 is safety. Let's say a patient fell down, that's a safety problem. Let's say a patient is trying to harm himself or harm others, that's a safety problem. Okay, number 5 is pain. Number 6 is education, patient education. Anytime a patient requires more education, then you're gonna give attention to them next. And then we're gonna give attention to patients with emotions. And when we talk about emotions, we're talking about maybe anorexia nervosa patients who have low self-esteem, low confidence, maybe chemotherapy patients who are feeling down, who are feeling a little bit depressed, not suicidal though, but you know, those kind of emotions, those patients come next. And last are psychotic patients let's say patients, with bipolar, schizophrenia, PTSD, anxiety disorders, and we're gonna talk about all that later in the course. And the last thing I want to talk about on this slide is, as you know, one of the NCLEX favorite traps is to give you a complex situation and then contact a provider. So contact a provider is number 9 that I want to talk about. This option used to drive me crazy. I didn't know when to select it and when not to, but I'm gonna give you a hack that you can use it every single time to eliminate or keep this option. As you know, contact a provider is something that you need to do with every complex situation, but it might not be the first thing a nurse needs to do. So how do you know when to call the provider first? You need to ask yourself this question. Does the patient have an immediate or significant need that I have to address before leaving the patient room? So listen, when I tell you to picture yourself in the environment that the NCLEX question is talking about, please do, because that will help you. So just imagine yourself, you sitting in that patient room, and you're looking at a patient, and you need to ask yourself, do I need to address the patient, maybe like assess the patient or do something, intervene, or should I go ahead and leave the room, call the provider? If the question is no, there's something that I can do first before leaving the room and calling the provider, then you do that thing first and you eliminate calling a provider, because that's not the first thing you do. 9 out of 10 times, you're gonna eliminate this option. But I want you to use this technique, visualization technique. Just visualize yourself in the patient room and ask yourself this question. Do I need to leave the room and call a provider? Or I need to do something first? Maybe it's an assessment, or it could be an intervention. Think about it this way. If a patient is struggling to breathe, will leaving the room to call a provider be the first thing you should do? Probably not. There are immediate needs that the patient has that you can address before going out of the room and calling the provider. For example, you could put the patient on oxygen. Maybe he's low on oxygen. You could put like a nasal cannula, right? You could elevate the head of the bed first and call a provider. So you need to think about it this way. If a patient is having airway problem and you leave them and you go call a provider, you're putting the patient at risk for danger. Okay? Let's go! Let's move to the next question. Paramedics call the charge nurse. They are coming in with 4 patients involved in a motor vehicle accident. Which patient does the nurse plan to see first based on the report? Listen, again, this looks like a prioritization question. So this is the first time it's gonna be general reading, which we did. The second time, you and me, listen, you and me, we're gonna pick up keywords. So I'm gonna read it again, and I want you to be thinking about the keywords in this question. Let's go. Paramedics call the charge nurse. They are coming in with 4 patients involved in a motor vehicle accident. Which patient does the nurse plan to see first based on the report? For me, when I'm looking at this question, if I want to choose keywords, I'm gonna look at motor vehicle accident. Again, anytime I'm reading an NCLEX question, I want to put myself in that environment. And listen, I apologize for repeating myself over and over again, but repetition is key for mastering the skill. So if I repeat it enough times, you're gonna hear my voice in your head telling you, picture the environment, okay? So motor vehicle accident is one of the keywords that I'm gonna choose, and the second keyword is gonna be first, because this is a prioritization question. Now, the third time, I'm gonna rephrase it in my own mind. So you and me are gonna look each other in the eye, and I'm gonna rephrase the question in my own words, right? So let's do it. A nurse is sitting on the unit, and then she receives a call from paramedics, and they say, coming in with 4 patients, and then they give her report. Those patients have been in a motor vehicle accident. So which patient the nurse is gonna see first, okay? Listen, it was not organized, but it has a story to it. It means that I understand this question. Now, I'm gonna look at the options, and guess what? We're gonna use the strategy that we just learned about prioritizations. Do you remember that? ABCs, beep. Let's see. The first patient is a 26-year-old patient screaming of pain. He has a visible right knee deformity and a weak lower extremity pulses. So looking at this patient, I can tell that his knee is either dislocated or broken, and then he's experiencing severe pain. He's 26 years old, and he's having weak lower extremity pulses, okay? Patient number 2 is a 22-year-old female who is responsive to painful stimuli. The pulse rate is 118 beats per minute with no visible trauma or injuries. Listen, if you know anything about motor vehicle accidents, sometimes patients go unconscious. Now, you're gonna tell me, hey Mo, how did you know that this patient is unconscious? There's something called Glasgow Coma Scale. I'm not gonna go in details about the Glasgow Coma Scale, but I'm gonna show you how does it look like, but we're gonna discuss it later when we're discussing critical care. But if you look at this option, a 22-year-old female who is responsive to painful stimuli. So she's unconscious and she's only responsive to painful stimuli, right? So when you pinch the patient and you cause pain, what happens, either she's gonna move or open the eyes, but she is unconscious. Or else the option would have said, this patient is responsive to verbal command, or this patient is alert, okay? So this patient is clearly unconscious. She has tachycardia, and there's no visible traumas or injury. What does that mean? She has been in a motor vehicle accident. The first thing I'm gonna think about is maybe this patient is having intracranial bleeding, or sometimes they call it intracranial hemorrhage, right? There's a difference between hemorrhage and bleeding. A rule of thumb is bleeding if you see visible blood, and hemorrhage if it's internal, all right? But it's a habit that we say in hospitals, I see bleed or intracranial bleeding, but in a matter of fact, it is hemorrhage. Option number 3, which is the third patient, a 6-year-old boy with a visible deformity to the forearm and crying. So again, this patient clearly looks like he broke his arm and he's crying, he's in pain. And option number 4, which is the fourth patient, an 8-year-old girl with a cut on the forehead, crying intensely, with a heart rate or a pulse rate of 126 beats per minute. So what's happening with this fourth patient? There's a cut on the head, the patient is scared, she's panicked, she's only 8 years old, she's so blood, she's, oh my God, you know? So if you wanna use your ABCs, listen, anytime I see a patient who has orthopedic problem, let's say arthritis, a broken femur, or fracture, whatever the case might, I just eliminate that patient. It's not a priority. I'm gonna look for ABCs, then safety, then P, okay? So I'm gonna look for airway problem. If I look at, so what I'm gonna do, I'm gonna eliminate a patient with a cut, I'm gonna eliminate a patient with the forearm deformity. So we have patients number 1 and 2. Clearly number 2 is a critical patient because this patient is at risk for intracranial hemorrhage and maybe increased ICP and might require immediate intervention, like immediate surgery. Patient number 1 might be tricky a little bit, and the reason is, yes, it is a fracture, but it's saying weak lower extremity pulses. But listen again, maybe that's his baseline, right? So if that's his baseline, in this option, they didn't say like there's a history of cardiac issue or whatever, so I'm not gonna assume. And I would say, if this was his baseline, is this the first patient I'm gonna attend? So I'm gonna go ahead and choose patient number 2 because this patient is unconscious, probably gonna have an intracranial hemorrhage, and that will increase the ICP. It might cause hypertension, and all that is related to circulation. So A, B, C is our third option, and that's why I would choose number 2. So let's read the rationale together. So option number 2 is the right answer. A patient might be experiencing internal hemorrhage and going into hypovolemic shock. So listen, by now, we're gonna have a lot of prioritization questions, but I just wanted to give you a couple of questions to practice this prioritization strategy so that you can get it out of the way, get it out of your system, and know for a fact that anytime you're gonna have a prioritization question, you're gonna put a smile on your face because that's what you're gonna follow, okay? Now I'm gonna show you the Glasgow Coma Scale real quick so that you can have an idea what a Glasgow Coma Scale is all about and how is it structured. So a Glasgow Coma Scale, it is composed of 3 parts. The first part is eye-opening response, verbal response is the second part, and the last part is motor response. So with every part, there is grading, there's a mark. So for example, if a patient opens his eyes spontaneously, then they take 4 points. So with every category, you're gonna choose one of the options and then you're gonna add all the numbers and then you will have your Glasgow Coma score. And again, you read through all the options. So option number 2 is eyes open to verbal command, speech, or shout. If you're shouting at a patient and then they open their eyes and they look at you. And the third option is eye open to pain, which is painful stimuli, which is our case in the previous question. And number 4 is no eye opening, so it doesn't matter if you're shouting, if you're pinching the patient, they are not responsive. So our patient in the previous question takes a score of 2 points because she opened her eyes to painful stimuli. And then you're gonna go to the second category, which is verbal response. So you've got 5 options. The first one is oriented, confused conversation, but able to answer questions. The third option is inappropriate responses. And the fourth option is incomprehensible sound or speech, where the patient could be moaning. Let's say you're calling their name and they're like, whatever. You don't understand what they're saying. That's number 4. It takes 2 points. And then the last one is no verbal response. And then you move on to the third category, which is motor response. You start with obeys command for movement. Let's say you are asking them to raise their right hand and then they do it. That's number 1. Number 2, purposeful movement to painful stimuli. Let's say you're pinching them in the left arm, they're gonna move the left arm. Number 3 is withdraws from pain. Let's say you're pinching them in the left arm, they're gonna move all over, not just, like push you away. And option number 4 is gonna be abnormal flexion or decortication. When you pinch the patient, they're gonna decorticate, which means inward. And then the last option is, or the fifth option is extensor, which is rigid response, or deceleration, which is to the outside. And the last option is no motor response. I mean, you're gonna pinch them, they will not move, and that's the worst. Then you add all the numbers from all 3 categories. The highest number you're gonna get is 15, and the lowest is 3. So your glaucoma score is gonna range anywhere from 3 to 15. Anything lower than 8, which is between 3 and 8, those patients usually have jeopardized airway and you need to intubate those patients, okay? Let's move on to the next question. Are you excited or what? Oh my God, let's do this.
Hey, I hope you are enjoying this so far. We are going to take a quick break and I am going to test your knowledge to see if you are absorbing the information. I'm going to ask you a prioritization question and see if you can utilize the prioritization strategy that I just taught you. ABCs, beep. All right, so there is a nurse who just came to her shift and she has 4 patients to see. Which patient will she see first? The first patient is a patient on PCA because of laparotomy. The second patient is a patient who is OCD and he is shouting at another patient in the TV room. The third patient is a patient with facial and neck burns who just arrived to the unit maybe 4 hours ago. And the fourth patient is a patient 24 hours after abdominal aortic aneurysm. So which patient will the nurse see first? Yes, you are absolutely right. The nurse will see the patient with facial and neck burns. Why? Those type of patients